When suffering from prolapsed hemorrhoids, walking and sitting can many times be frustrating and you can feel irritated in your rectum. You always feel that lump sticking out from your anus, and when walking you can feel it every step you take. How to push a hemorrhoid back in? Then you can do as follows: put on a latex glove, lubricate your finger, bend your head and chest down and gently push the hemorrhoid back inside. After you have pushed the hemorrhoid back inside, place an ice pack on the hemorrhoid area to calm down the irritation and clean your hands. How to push a hemorrhoid back in? To push the hemorrhoids back in you need a few things: a pair of latex gloves, a lubricant, an ice pack, a soft piece of wet cloth and soap and some water. To push the hemorrhoids back in, start with putting on the latex gloves. After that, lubricate your index finger. The purpose of lubricating your finger is to avoid irritating the hemorrhoid, and it's not so painful too. It also creates less resistance and makes it easier for the hemorrhoid to slide back in. Get into position, either by bending your head all the way down so that your chest is close to your thighs. You can do this when standing up. The other way to do this is to lay down on your side and lifting one leg up against your chest and leaving the other one straight. The goal is to help you get better access to your anus. After assuming any of these positions, use the lubricated finger and gently push back the hemorrhoid inside the rectum. When pushing the hemorrhoid back in, be gentle. After pushing the hemorrhoid back, place the ice pack on the anal area. This will help reducing the swelling and also help with the pain. To protect your skin, place the soft piece of cloth between your skin and the ice pack. After you are done, wash your hands thoroughly by using the soap. A few things to take note of when pushing back the hemorrhoid. Pushing back the hemorrhoid is not a treatment. It's not a way to cure or treat the hemorrhoid. It might make things less uncomfortable, but it doesn't heal the hemorrhoid. Recurrence: the hemorrhoid might come back out again, even after pushing them back in. This may happen every time after a bowel movement. See a doctor. After you repeatedly tried to push back the hemorrhoid in again but it keeps coming back out again, it might be time to see a doctor. Remember, treating hemorrhoids is not that hard. You may want to try this extremely helpful method that has helped over hundreds of thousands already, including me. This also shows how to prevent you from getting hemorrhoids in the first place. Go here to find out more. This will take you to a video. Just sit back and watch it and see if it can help you or not. What are hemorrhoids? Hemorrhoids or piles are inflammation of the veins in the rectum or lower large intestine. There are two types of hemorrhoids. First, when located in the rectum, this condition is called external hemorrhoids. Meanwhile, hemorrhoids that are located at the end of the large intestine are called internal hemorrhoids. Nearly 3 out of 4 adults suffer from hemorrhoids. However, hemorrhoids can happen to anyone. Hemorrhoids often occur as a result of straining during defecation or childbirth. There are many ways you can treat hemorrhoids, both with home remedies and surgery. Before talking further about hemorrhoid treatment, you should first identify the signs of hemorrhoids. What are the symptoms of hemorrhoids? Although sometimes it does not cause symptoms, sufferers will feel pain when blood clots occur during hemorrhoids. Symptoms of hemorrhoids can be different, depending on their location. Does the patient suffer from internal or external hemorrhoids? In general, some common symptoms usually affect patients, namely itching or irritation in the anal or rectal area, discomfort or pain in the anal area. When defecating, there is blood, there are lumps and swelling in the anal area. Next are the symptoms that occur in hemorrhoid sufferers based on the location of the hemorrhoids. 1. Internal hemorrhoids. For this type of hemorrhoids, initially, the patient does not feel any complaints. Internal hemorrhoids are located in a deep area, so they are usually not visible. But over time, due to friction by feces during defecation, especially when straining or the stool becomes hard, eventually damage the surface of the hemorrhoids and cause the sufferer to bleed when defecating. If internal hemorrhoids are not treated immediately, and they get worse, the swelling of the blood vessels in the large intestine at the end of this will come out into the rectum. The discharge of blood vessels in internal hemorrhoids is a benchmark for assessing the severity of the patient's hemorrhoids. Here are the stages of internal hemorrhoid severity. The first stage, the hemorrhoids have not come out into the anus or rectum. Second stage, hemorrhoids that come out into the anus can re-enter on their own. Third stage, hemorrhoids come out but can be put back with fingers. Asterisk fourth stage, hemorrhoids come out and cannot re-enter at all. To ensure that there are internal hemorrhoids that have not come out, the patient can see a doctor. The doctor will perform a digital rectal examination. In a digital rectal examination, the doctor will insert a lubricated finger into the rectum to feel for hemorrhoid lumps. The doctor will carry out a further checking by looking directly at the condition of the lower intestine. The doctor will be using a medical instrument called an anoscope, proctoscope, or sigmoidoscope. 2. External hemorrhoids. External hemorrhoids will usually itch, and if rubbed or irritated will cause bloody stools. The swollen veins in external hemorrhoids usually can be seen as lumps in the rectum. Doctors can recognize external hemorrhoids just by examining the rectal area. In external hemorrhoids, blood can collect and form a clot, thrombus, which can cause intense pain and a hard lump in the anus. How to get hemorrhoids back in? For cases of hemorrhoids stage 1 and 2, both internal and external, sufferers can perform care and self-medication at home. The ways that you can do is: 1. Eat foods that are high in fiber. 2. Drink enough water. 3. Not straining during bowel movements. 4. Not sitting on the toilet for a long time, for example, avoid reading or playing games on a smartphone while on the toilet. 5. Sit and soak the buttocks in a warm water bath. Sufferers can do this several times a day. 6. Especially for external hemorrhoids, clean the rectum carefully after defecating. Cleaning the anal area is usually more difficult if there are hemorrhoid lumps on the outside. In addition to the above treatment steps, you can also consult with your doctor about getting pain relievers, laxatives, or using suppositories to relieve pain due to hemorrhoids. You can treat hemorrhoids that are still in their early stages at home, but if your stool is already bleeding, you should immediately see a doctor. For internal or external hemorrhoids that have reached stages 3 and 4, the patient may experience heavy bleeding. If so, usually, the doctor will recommend surgery. There are several surgical techniques to treat hemorrhoids. Here are some of the types. 1. Rubber band ligation. The surgeon will tie the hemorrhoids with a specific rubber material. This binding causes the hemorrhoids to lose blood supply so that the hemorrhoid lumps will shrink and eventually disappear. 2. Sclerotherapy. For this method, the doctor will inject a type of chemical into hemorrhoids, which causes hemorrhoids to turn into scar tissue and shrink. 3. Laser therapy. In this procedure, the doctor will use a laser beam to shrink and harden the hemorrhoids. 4. Hemorrhoidectomy. This hemorrhoid surgery procedure is performed in an operating room and uses an anesthetic. Hemorrhoidectomy is a surgical method in which the doctor removes entire hemorrhoid. 5. Stapled hemorrhoidectomy. This procedure is the latest surgical technique for treating hemorrhoids and is the treatment of choice for severe hemorrhoids. This operation does not remove the hemorrhoids, but rather tightens the loose supporting tissue so that the hemorrhoids do not stick out. Conclusion. So, hemorrhoid treatment depends on the location and severity of the patient. For external hemorrhoids and internal hemorrhoids, if they are still in the first 2 stages, the patient does not need to receive surgery. Patients will need surgery if external hemorrhoids are showing symptoms or if internal hemorrhoids have entered the final 2 stages. A good metabolic system can save you from hemorrhoid symptoms. Exercise is the best way to keep the body's metabolism running well. Regular exercise can also improve intestinal performance so that it can digest food optimally. A good sport for people with hemorrhoids is yoga. Yoga practice goes hand in hand with breathing exercises so it can strengthen your abdominal muscles and tone your overall muscle performance.